Hold on, does lack of vitamin D cause fibroid? Can it directly cause fibroid? Can low vitamin D level increase risk and growth of uterine fibroid? Well, stay with me today. Let's uncover this discussion about fibroid. Study shows that low vitamin D level are strongly associated with an increased risk of developing and growing uterine fibroid, with study indicating that about 85% of women with fibroid may have low vitamin D level. Hello family, welcome back to the channel. My name is Uchechi Chizindu and I'm a clinical physiologist. If you are new here, you're welcome. We do educational health content. Do well to subscribe so that you'll be notified anytime I post a new video. Now let's get into the subject matter of today, fibroid. Firstly, let's understand what fibroid actually is. You might be hearing of fibroid. So what exactly is fibroid? Fibroids are non-cancerous growths. They grow on the muscles of the uterus, they grow on the muscles of the womb. Now, fibroid can cause heavy or prolonged period. They can also cause severe cramps, anemia, maybe due to heavy bleeding, pelvic pain, infertility, or even pregnancy complications. Now listen, fibroids are hormone sensitive, especially to estrogen and progesterone. If you have fibroid and maybe you're taking fertility medication that might increase your estrogen or maybe your progesterone level, I just want you to know that you are worsening the issue. Before you take any fertility medication, particularly if you have fibroid, make sure you consult your doctor. Don't just take anything you see online or maybe any advice you see online and start taking supplement like that without proper recommendation. It is not advisable. So does lack of vitamin D cause fibroid? Now before I answer this question, which is the main topic in this video, I want you to remember something. Fibroid is not caused by a single thing. Multiple factors can contribute to developing fibroid. I want you to get that clear. Sometimes the cause can even be unknown. Now let's get back to the main question. Does lack of vitamin D cause fibroid? Can it directly cause fibroid? The answer is no. Don't worry, I will explain. I want you to note that low vitamin C deficiency does not directly mean that you have fibroid, but low vitamin D level can increase your risk and growth of fibroid. I don't know if you get me. If you're on low vitamin D level, or maybe you have low vitamin D, that does not directly mean that you have fibroid. Some persons can be low on vitamin D and they don't have fibroid. But having low vitamin D can increase your risk of developing fibroid. I don't know if you are clear. Like I said earlier, study shows that about 85% of women with fibroid may be low on vitamin D. Several studies have found that women with fibroid tend to have lower vitamin D level, and women with adequate vitamin D level are less likely to develop fibroid. In fact, there's a study where they take fibroid cells and they expose it to vitamin D, and what happens? The fibroid cells tend to grow slowly. They don't grow fast, they grow slowly. Now listen, vitamin D appears to reduce abnormal uterine muscle cell growth. This is why vitamin D is very important in our body. You see, fibroid grows because certain hormones in our body, mainly estrogen and progesterone, are basically feeding them. Now here is the thing, hormones can't just enter into your cells anyhow. They need receptors. Now think of receptors as a door. Fibroid have too many receptors, they have too many doors in your womb. So when estrogen and progesterone comes in, remember estrogen and progesterone is what regulates our cycles, both menstrual cycles, even pregnancy. These hormones plays a major role. So when these hormones comes in contact in your womb, the fibroid receptors will like come in. This is where vitamin D comes in. Vitamin D helps to close those doors, helps to close those fibroid receptors. And when this happens, they don't grow fast because they don't feed much on estrogen and progesterone when their door is closed. So vitamin D is very crucial, it's very essential in our body. I don't know if you understand. I'm trying to explain this as simple as possible. So even if estrogen is in your body, it can't push fibroids to grow as much faster as it should. Another thing you should take note of is that fibroid cells tends to grow so fast. So what this vitamin D does is that it tends to slow down their growth. tend to stop them from growing fast as they should. And one more thing, unhealthy cells in our body are supposed to die off naturally on its own. The body renews itself naturally. But these fibrous cells, they don't want to die off. So what this vitamin D does is that it tends to remind them, hey, it's time to die. Now listen, vitamin D is not the cure for fibroid. Let's be clear on that. What vitamin D does is that it can slow their growth, it can reduce their feeding. That means it can close some of those receptors or some of those doors that they use to feed on those hormones, estrogen or progesterone. Vitamin D can close those doors. This helps to slow their growth and helps prevent things from getting worse, especially if you are deficient of vitamin D. If you're a lady watching me right now, especially if you have dark melanin like myself, you can see my skin. I'm a dark skin girl. It is important to include vitamin D in your supplements, even if you don't have fibroid, especially if you are vitamin D deficient. In fact, study shows that black women are 2 to 3 times more likely to develop fibroids. And this is because of our melanin. They often get them early. You can see a lady in their 20s, in their 30s having fibroid. This is a big concern for us black women. Vitamin D is not just a vitamin, it behaves like a hormone. Now, how do we normally get vitamin D? We get vitamin D mainly from sunlight. Now, sun hits your skin makes this vitamin D, your body activates it and sends it to where it's needed. Now, here is where the problem lies. Here is where melanin comes in. Our melanin is amazing, it protects our skin, but at the same time, it acts as a natural sunscreen. So, the more melanin you have, the less vitamin D your skin can make from the same amount of sun. That means a light skinned person can actually sit in the sun for about 10 to 15 minutes and make enough vitamin D, while a darker skinned person can sit on the same sun and still not make enough vitamin D. So even if in hot places that their climate is hot, a lot of black women are actually vitamin D deficient. And the issue here, some of them don't even know that they are vitamin D deficient. Now, why does all this matter for fibroid? Fibroids grows because of estrogen and progesterone. They respond strongly to this hormone. Vitamin D job is like a brake, it helps slow things down. Inside the uterus, vitamin D helps to calm cell growth. It tells abnormal cells not to overgrow. Vitamin D also helps to close those receptors, those fibrous receptors and doors that allows estrogen and progesterone to come in. So when this happens, it slows down their growth. So vitamin D is very, very crucial and important for us in our body. Correcting vitamin D deficiency does not automatically shrink fibroid. You have to get that clear. It does not reverse severe fibroid overnight. We not replace medical or surgical treatment when needed, but it may slow fibroid growth, reduce inflammation, support hormone balance, or even improve overall reproductive health. This is about risk reduction, not about miracle cure. Just like they say, prevention is better than cure. So for a recap, does lack of vitamin D cause fibroids? The answer is no. Can low vitamin D level increase the risk and growth of fibroids? Of course, the answer is yes. Now, if you find this video helpful, don't just scroll, give a thumbs up. Don't forget to like, subscribe, and share. Bye.